let's say 5 or 6 teenagers sat in the grass, on the grass. And one of them says, I had a rough night and I self-harmed. It's good to talk, but what about the other 4? Let's think about that. That individual has spoken, and they should. But it's important that there's responsibility. Because what about if that young person, the other 4, I'm really worried about that person. I'm scared for them. And what about if that progresses into illness? And what about if there is another person who goes, oh, that's a way to cope? Do we have a mental health crisis? Yes, but maybe it's also a pandemic. Because the surroundings that we occupy ourselves in impact us in all different ways. Everyday emotions cannot be framed as illness. Grief, the hardest thing we will ever experience, but it doesn't start with illness. It doesn't start. Not usually. And this is what we have to understand, is that as we journey along life's path and we see the things that test us, they're not necessarily illness, but unchecked, they can turn into illness. So the question that you might be thinking all of a sudden is, well, how do we know that it's illness? I am not a trained practitioner. I'm a person who does education stuff. It is not my place to decide when illness has breached into a dangerous place. That is for the trained professional. And I might be wrong about that. I might be a simple little chappie with a simple little idea. But how do we know? It is not my decision. I need to talk to a doctor, a GP. I don't need to go on TikTok. I'm sure no one here has TikTok. Maybe. But is that a dangerous place? Yes. So how do we know? Well, we seek professional help because that is why they're trained. And yes, we know services are stretched. We get that. But we need to speak to at least our GP. Social media, life, everything that we've experienced of change in the last 40 years came up on the video. Let's have a think about our lives now. Compared to 40 years ago, some of you might not have been around 40 years ago, I don't know. But we can track the last 40 years of social change. Have a think about it. Change so dramatic in the way that we live. Social media, yes, but the way that we are driving all over the place. We work in different time zones and all over the place. Nothing sits still. We get used to one social media platform and it turns into another. Another idea pops up on social media or in the media and we are onto another idea, another concept. Life is so fast compared to previous generations. Think about the dangers of that. Are we seeing? Do we have complicated lives? Do we have simple lives? Is this impacting our health, or am I talking rubbish? We have to understand our lives have changed, but we haven't perhaps seen it as much as we should. The hardest thing when in illness is to get out of bed in the morning. And if you've been in that position, you will know the hardest thing is to get out of bed in the morning, to dream about the future, to dream about what to do in the next hour, the next half an hour. But that doesn't mean that we have to stay there. It doesn't mean that it's our destination to be there. Diagnosis is the foundation of recovery. For some, that might take weeks. Some, that might take years, a lifetime. But we have to also challenge ourselves, don't we? I thought I was challenging myself for many years, but I don't know if I actually was. I once thought and said to myself that my best friends were depression and mania. My best friends were my diagnosis. That's how I felt. That's how I saw things. But we have to challenge those things as